everyone, and welcome back to another episode of Seniors Blue Book University. I am your host, Heather LaPaglia. I have with us Lukas Baker. He is an insurance agent and is going to share a little bit about his insurance agency with us. Lukas, thank you so much for being with us today.
Hey, Heather, thank you so much for having me, and good morning to everybody watching. My background really is actually was originally in teaching, and I was an English teacher for high school kids for about 5 years, and then I transitioned into the insurance agency business, and now I'm an independent agent. And my main focus here is to really help seniors understand the route to Medicare and the options that they have.
Excellent. So I know that Medicare seems pretty straightforward for most. Could you talk to me a little bit about some of the general questions that you maybe get asked about Medicare?
Yeah, I think that most individuals understand that when they turn 65, they need to have Part A and Part B in place, unless you're going to continue with your employer coverage, and then you can delay Part B for a time. But after that, I think it does get confusing for a lot of folks. And some of the questions I get and a lot of worries that people have are about their prescriptions. Their employer plans and the Medicare prescription plan they're going to receive are going to be different. And it's very important that the formulary and the dosages and all of those things are correct for the insured person. And so that's always a big concern that, seniors bring up immediately. Are my medications going to be covered? I need to make sure of that. And that's understandable. And also they need to understand how that prescription drug plan works. A lot of seniors don't understand that you do have a deductible with your prescription drug plan in a lot of cases. And then you may reach the donut hole. And there are just other terms and insurance jargon that, folks just can't understand without somebody helping and guiding them. So prescriptions is definitely one big thing. Another thing is going to be understanding the differences between their options, because after you enroll in A and B, you have the option of going in the Medicare supplement, also known as a Medigap route. And, those are plans like G and N and those alphabetical letters plans. Then the other option you have is the Advantage side. And a lot of folks come to me and they talk about how they see these commercials on TV about these $0 premium plans and what could those possibly be. And a lot of the times those are advertising Medicare Advantage. And so most folks don't even know that there is two choices. So that's definitely something I get, understanding the difference between, Medigap and the pros and cons there, and then Medicare Advantage and pros and cons there. And then I'd say the third thing and important as well is your doctors, right? And whether your network's going to be an HMO network, a PPO network, or if it's a Medicare supplement, you really have a nationwide access network. So those are major questions that I get and that people come to me most often with.
Fantastic. And so when I was in senior living and I worked in the housing industry, I got questioned a lot about the difference between Medicaid and Medicare. And I
Okay.
know it's easy to kind of confuse those two terms because they're very similar in name.
Yes.
What would be one main distinction for folks if they're just a little bit confused on that?
Yeah, they are named very similar. So it's tough sometimes and you confuse them, and which is understandable. So Medicaid is a free government-based insurance program that only applies to people of low income, right? And typically that Medicaid is for under 65, but there are individuals who are with Medicare as well who have something called dual eligibility, which is when they have Medicare and Medicaid together, okay? And so that they meet those low income qualifications, as well as they're on Medicare, meaning they are 65 and over and, on an Advantage plan or a supplement.
Okay, that was going to be my next question is, could someone have both? And they can.
Yes.
Okay, that's
Yep.
good to know. I know many of our viewers will have that question as well. My other question is, let's say someone is getting ready to kind of leave the workforce and they're looking forward to retirement. What are some of the questions that they should either be asking their employer or doing research on their own to prepare and see if they're eligible for Medicare? Do you see that often when people call you?
Yeah, I do. And a lot of folks will call me around, 62, 63 when they're planning on retiring, and maybe they want to retire early and they're trying to find out their options. And that's a different path too. So we can lead you to Medicare. But for your question specifically, are those people turning 65 and what should they prepare for when they're, exiting their job? Well, they need to know, one is the most important, is the end date of their employer coverage. Now, some employers will say that, your coverage is terminating on the 15th of April, but you'll continue coverage through the end of the month. We'll carry you on to the end of the month. And there are some employers who maybe aren't as forgiving, and they say, no, when you're terminated on the 15th, you're terminated. And so that's one thing that you need to make sure of. Make sure that when you end and you retire, that is also the end of your insurance. Another thing to think about even before, so here's the CMS guidelines behind when you turn 65. You have 3 months before your birth date, the month of your birth date, and 3 months after to enroll, change, etc., your Medicare policies, whether that be Part A, B, Medicare Supplement and Advantage. So it's a total of 7 months. Obviously, if you're proactive, you want to get on that early. And I would look into getting a Part A and Part B effective date set up. Most folks that I need to speak to should have their original Medicare card already. So that's that red, white, and blue card with your Medicare number on it and your name. And you want to secure that in place. You can secure it before you leave your job. I would say at least a month, the month of you're leaving the job, try and file that with the Social Security office and get that card in the mail. And once you have Part A and Part B effective, I would be speaking to somebody. If somebody was planning to retire, for example, at the end of April, and they wanted their Medicare to start on, and their birthday was in May, they're turning 65, I would want to speak with them in April so that we could get that set up for May 1st with no lapse in coverage when they lose their employer plan. So these are things you need to consider. I know that some people don't take prescriptions, which is great when you're 65 and older. That's awesome. But at the same time, you still need to get that PDP plan when you get into Medicare, because we want to avoid that penalty that might come along with not having it. So,
yeah, that's a really, really good point. This is a ton of fantastic information for folks that are on Medicare or considering getting on Medicare. But I know that as an independent agent, you have the opportunity to help a number of folks with lots of different insurance needs. So just real brief, high level, what are some of the other insurance options that you can provide for folks?
yeah, I think what I love about being an independent agent is that I can kind of let off the brake on the whole sales aspect of Medicare and really focus on education, because I have all the carriers here in Pennsylvania, really that are the major carriers in Medicare. The big names everybody's heard of: Aetna, Humana, AARP, UPMC, Highmark. These are all big carriers that anyone would come across on TV, et cetera, that I also have access to. And so consulting with me and picking my brain, all of that is free to the insured person. It's not a cost to consult with me. Whatever carrier you end up choosing and we end up deciding with would be the one to compensate. And so a lot of folks sometimes don't even, they hear the word independent agent or they hear the word broker and they think they have to pay a fee to even speak with me. And I just want to clear that stigma up, that's not something, nope, that's not necessary whatsoever. So
Fantastic. And how would someone get in touch with you if they did have some questions about insurance today?
Yeah, several ways to get in touch with me. My phone number, my business number is 724-594-7648. You're absolutely welcome to visit my website, which is www.consultbaker.com. My Facebook has a business page as well. You can check me out on Google. If you Google Baker Consulting Services, I'm located in Butler, Pennsylvania. And check out the reviews and see if you want to talk to me.
Fantastic. Lucas, thank you so much for your time today. Look forward to speaking, and this is going to be really great information for our viewers. So thank you.
Thank you so much. I appreciate the opportunity to come on here, Heather. I appreciate it.
Absolutely.